Design or reorganize your supply rooms with innovative products from Akro-Mils. A well-organized supply room is critical in healthcare and medical settings. Extra time spent by physicians, ancillary staff, and nursing staff searching for supplies can affect the quality of care and timeliness being given to your patients. Akro-Mils, a North American leader in storage, organization, and transport products, has designed a variety of solutions to assist you in the planning and implementation of reorganizing cluttered, unsafe, and disorganized supply rooms. Using these easy-to-follow steps, your supply room reorganization team can get you started immediately on your plan. Step 1. Appoint a leadership team of 3 to 5 diverse members that will work together in the decision-making process to make the project a success. It is recommended that the team have representation from nursing, materials management, ancillary staff, purchasing, and your Akro-Mils distributor contact. Step 2. Assess the current supply room situation throughout your facility. First, survey your staff members about the current supply room setup. What supplies are easy to retrieve? What items are hard to find, and how much time it takes them to find supplies? Be sure to ask staff members how they use the supply room. Are similar items placed near each other so they're easier to gather? What items are needed most frequently? Second, assess the current shelving units in use. Will these units remain or need to be replaced? Third, examine the need for a color code system for your supply rooms. Is there a color code system currently in use? Would it be beneficial to create a new one or revise a current one? A color code system could be developed using different bin colors or different colored labels on the front of the bins. Akro-Mils created a color code chart that can be used for your facility. You can modify this chart or create your own. Finally, assess the use of all departments that might store items in the supply room. Are items mixed together, or are they clearly separated and labeled? Step 3. Sort the items in your pilot program supply room, which is the first step in the 5S process. Place supplies in groups of like products, for instance, wound care or respiratory therapy. Items that are used the most often should be noted in the plan. These items should be stored at a height from waist to shoulder to prevent staff members from having to constantly bend or stretch. Review par levels and determine the appropriate size bin or container for all supplies in the room. For best results, we recommend using Akro-Mils products on shelving units and louvered panels. Step 4. Measure the supply room and note any special circumstances. For example, is the shape of the room unique, or are there items in the room that take up a lot of space, such as wheelchairs or oxygen tanks? Using a whiteboard or pen and paper, try different arrangements of shelving or racks, or ways to use louvered panels to maximize your storage capacity. Looking at the range of possible room configurations, determine the best plan for the supply room space. Be sure to review this preferred arrangement with representatives from the nursing and materials management staffs to ensure agreement and take ownership of the new plan. Step 5. Determine the optimal date and time for your pilot supply room reorganization. For instance, days that typically have a lower patient census and times of day that will not affect supply replenishment. Step 6. Prepare labels or labeling systems for bins and shelving units in advance of your reorganization day. Step 7. Organize your existing and new shelving and install your louvered panels. If louvered panels need to be installed, it may be necessary to have the maintenance department install the panels. Please remember to follow Akro-Mils assembly instructions when installing louvered panels. Step 8. Tackling one area of shelving or louvered panel at a time, reorganize your supply room. As part of the room reorganization, you will also perform the next 2 steps in the 5S process. Step 2, sweep, and Step 3, straighten. Step 9. Speak to members of nursing staff, center supply staff, and others that use the room about the layout of your newly reorganized supply room. Explain color code categories, point out locations of frequently used items, and inform other departments about the changes. Step 10. Survey staff members on the effectiveness of the new program and make any final adjustments needed to increase the efficiency of the supply room. Step 11. Now is the time to ensure that the final steps in the 5S process are adhered to. 5S Step 4. Schedule. Make sure the 5S schedule and checklist are clearly posted and followed daily. 5S Step 5. Sustain. All staff members must be dedicated to sustaining 5S in your facility. Finally, create a plan to convert the remaining supply rooms in your facility with this newly reorganized room as your guide. Inviting nurse managers and nursing staff from other floors will help communicate the benefits of reorganizing supply rooms. If all supply rooms were set up and color-coded the same, it would be much easier for staff who float or ancillary services to find supplies faster and easier, and this will allow them more time to take care of patients. Using the 5S process and Akro-Mils products created specifically for healthcare settings, you can transform a difficult and frustrating supply room system to one that is clean, organized, and a benefit to your staff and patients. For more information, please contact your local Akro-Mils sales representative or your Akro-Mils distributor contact.